So I'm going to, we got a number of questions.
But it's like a platform.
I will say I've had this role more than once, and often the three presentations and my own seem to be on 3 or 4 completely different topics. Today, I think there's some coherence that hopefully will lead to a little bit more conversation. One of the things I want to do with my panelists here is to encourage some reactions to each other as well as just to questions about individual presentations, because I do think there was such alignment across the topics covered. I'm going to start with a question, and often I take the ones that are submitted and turn them slightly, but I want to talk about something that was raised by a questioner that was very much on my mind during the presentations, which is the time element of change. And someone made reference to 11 years to get a park, and obviously the civil rights movement. The story you told focused on one element, but the movement, of course, over generations. When I think about whenever someone tries to promote change, there's often discussion of finding intermediate wins that you can celebrate because the ultimate goal takes so long to achieve. But I'd like to turn to all of you, and particularly, again, thinking about the comments Karen made at the outset about a movement and about philanthropy and philanthropic resources. I'd just be interested in your reflections on how to set realistic expectations for those who are participating in efforts to change, how to sustain interest and motivation as there are setbacks, how to sustain support. Who wants to talk about the time dimension?
So when I think and I'm going to talk about the whole movement, but we reflect about that all the time. The changes, the long-term changes in our society are sometimes, so distant that people might just decide not to participate more. So our community workers, our promotoras, and the rest of the team have decided to see this in 4 levels that are happening on an ongoing basis. The first one is the ongoing invitation to join. And they say, how can I invite you if I don't know you? So there is an ongoing commitment to go to the streets, house by house, to every place and invite people on an ongoing basis, because we understand that the ones here are just, a group. It's just a little group. So we need to keep going, never thinking that that's it. The second one that they talk about is the space where we get to know each other. And this is a space where in ongoing basis you get together and you talk about a lot of things, not just that long-term goal. And when action is needed, you still are there. The difference is to be in a movement where you are called to take an action one day. Yeah, no, we support that, bye. Call you next year. That doesn't work in this type of movement. It has to be ongoing activities, ongoing relationship. It has to be relevant. Our interaction needs to be relevant. The third one is that in communities, there has to be a service of value. Because in those groups, in the meantime, you need help with this and you need help with that, And the fourth one is to create mechanisms for people to participate in specific projects. So the park meant a park 11 years later, but 11 years of organizing, advocating, inviting, creating relationship. And what is happening now in Santa Ana, that we are able to influence the general plan and put 300 people, 400 people in that city council in any moment, is the result of those 11 years. So it's not just one thing at a time.
So I would add, one of the things I talk about is patient urgency, and that this work takes this sense of patient urgency. And what I mean by that is that you have to have the patience to do the trust building and relationship building that America has talked about. But there's also that sense of urgency that people's lives are at stake. I mean, there's issues that are affecting them right now. and that we have, and to me, it's a tension that you hold, not one that you resolve. The goal is to hold that tension and recognize it as such, and that when you have too much patience, you get bogged down in process, and you can get bogged down in just kind of like not getting anything done. And on the other side, when you take shortcuts and you run over people, that's not sustainable. And so you've got to kind of hold that, and the ideal is that if you're feeling like if half the group thinks you're moving too slow and the other half too fast, you're probably holding it about right. But you want to hold that tension, and at the same time, I think, in my work with collective impact efforts, I always say, if you're not in it for at least 5 to 10 years, don't do it. And recognizing that it takes a long time to create that kind of needle-moving change, you have to figure out what are the momentum builders that can let people know that you're actually accomplishing things on behalf of the people that you serve, and not just, again, getting bogged down. And what I say is there are a lot of times where there's a lot of collective and not a lot of impact, and you've got to, again, kind of hold that and move it forward.
So when I think about it, I talk a lot about this whole idea of soul work. And I would ask you rhetorically, if the work that you're doing right now, the communities that you are serving, and whoever your stakeholders are, would you consider this your soul work? And the way I answer that is, if you didn't make one dime doing this, is this what you would do? When you read about this topic or this issue, do you flip back and you say, wow, I just read 150 pages? Is this what draws your attention and you're passionate about it? Now, you may not like this leadership above you or your team, but that you are in the right seat on the bus. So that's number one. Number one, that's important to be doing your soul work. The second piece is that change is relative. And so what is your goal? And those goals will change over time. So my goal, I thought initially, was I'm going to be an OBGYN, I'm going to take care of patients every day, and I'm going to change lives. And I learned right away, pretty early on, with a lot of the information that you said, that, whoa, wait a minute. The patients that I became a doctor for, I'm not going to be able to take care of them in the way I thought I would. So it shifted, and my goal was, I want to create a career that has public health, medicine, and policy, because I learned that policies really drive things. Now, there have been a lot of successes and things that have changed, and some of them are small and incremental, but the big piece I think is really important is celebrating each incremental step, and not celebrating alone, but celebrating collectively. So tonight, when I leave out of here, I'm gonna celebrate, and I'm going to celebrate something as small as I finished my talk. I went over time by 3 minutes. But that's okay. Together we came, and together we will walk out of these doors and go to our individual places. But are you doing your soul work? Are you celebrating every incremental stage? And at the end of the day, when you look back over your life, can you say that these are the things that I impacted? These are the things that I can say I changed, and stay focused. The other piece that I would leave with is that I think a lot of us think that we're supposed to win everything. And part of accomplishing change or making a difference is those plateaus. And over time, it's about progress over perfection. It's not going to be perfect. There will be fallbacks. There will be people who might not even get what it is that you're trying to do. But in those levels of plateauing, that you stay focused, that you know where you're going, and you continue.
I want to bring in an issue of, I guess, what I would call governance, which is local change. Local institutions, local governance is variable around the country, and I had the experience of working here in Colorado with the county system. It's different everywhere. But when I think of local, I think of certain assets, and I think of some real limitations, and I'd be interested, again, if we're trying to move things along, how to grapple with those. One of the limitations is often there's often a sort of an establishment that maybe focuses primarily on the business interests, but is leaving certain communities behind. But they've been there forever, and that's how we've done things always. Another limitation is often media attention. There's, local papers are dying out. It's hard to sustain attention on an issue that you're trying to draw attention to locally. But of course, there's the advantages of scale, and trust really can only be built locally. So someone asked about how to break through some of the barriers. in general, I think local is less polarized partisan than the nation or states may be. But I wonder if any of you could comment on how to address some of the governance challenges when you're trying to make change happen at a local level. And you don't have to all go in order. You don't even have to all answer every question. But I don't know who wants to speak up, so.
Right. Well, I think that everything has limitations. Probably should be the short answer. National might be diluted. People don't own it. Organization can happen nationally, particularly with social networks. But there is a level of organization when we talk about equity that happens in the place. And that cannot be replaced by any national platform. I think that we can overcome many of the limitations by the organizing that is happening among different local groups. Local might be very unique, and that is not bad. Local might not be scalable, and that is not bad. And again, I warn against the dominant paradigm concept of success that is gigantic, and if it's not scalable, I don't want it. I want something that works for our communities with their uniqueness, and then if it's scalable, great. I always know that there are pieces that are scalable, and that's fine. There are different governments. Sometimes you are facing groups locally that are horrendous, that just hate us. And there are other cities in which there is more openness. You have your local fight. And without the local fight, there is nothing. Also, the relevance. I think that the relevance issue at the local level is higher. And also, I think that local could be your entry point to national. So there are many, many advantages. I would say that we need to explore the limitations and explore the benefits. At the end of the day, it's a combination of both. It's a combination of short-term, long-term, local and national, and international for many issues. So I wouldn't just get stuck on that.
Yeah, I mean, I think that on the governance piece, the question I always ask is, do you have the mix of people around your table, whatever your table is, that you have the best information about the intended beneficiaries, the issues, and the neighborhoods you're serving? And kind of going back to what America talked about earlier when she was talking about the data and all of this, it's data's information about people's lives. And are we testing our assumptions, our interpretations, even our selection of data against what people actually experience and see? And if the community, if you had our intended beneficiaries watching our conversations in a fishbowl, would they feel they were well represented by the conversations in our rooms? And so I think that when we think about governance, it's a doing with. It's not, as America said. And I think that our governance tables have to better reflect that. And that doesn't mean there's not room for experts and professionals and all that, of course, but we have to have people who really understand the community, who have what I call context expertise, as well as people of content expertise to make it work.
I got a question that I think is an interesting one to get some responses to. I'm going to read it directly and then expand on it slightly. It says, as an individual in the mainstream ethnic group and gender identity, I assume that means the majority, I haven't learned how to be part of a community. Cultural solidarity is not prominent. How can individuals like me, essentially communityless, join a movement like the one envisioned here today? So the first thing I want to say is, I think what I like about the question, it's these are the things I suck at kind of question. It's like, and so the questioner, it's anonymous, but the questioner is suggesting a vulnerability. And I think by doing so is asking honestly for help to say, I want to be a part of this, but the circles I live and work in don't have these conversations. We're not doing that. It's not, so how does one who is aligned conceptually with the kind of change being discussed here, but is not doesn't feel part of a community that's taking on these issues, provide support for community-based and locally based efforts.
So to that person, thank you for being vulnerable and asking important questions. I would say to continue that, to ask those hard questions. And at the end of the day, I would say you probably belong to a lot more communities than you think you do. And even when I talk about gender, I don't know what the gender is of the person who wrote that, but that splits you into 50-50, 49-51, depending on the year, into a community of your own too. But what I would translate that into is, how do you become a leader? And not the positional leadership where you have a title, but a leader who can carry the voice and the opinions and the ideas and the movements of what we're talking about. So I am going to assume that if you're here because this is something that you're interested in, and most people are here because of that, not necessarily that they're mandated to be here. And if you're mandated to be here, then it's because you work for an organization where your mission fits into this work. And so if you're early to this work and new to this work, then welcome to the family. So whoever that is, can we give them an applause? Because you have a community. This would become your community. And so I would say the things that you could do: keep asking questions, and while you're here, meet at least 10 new people that you didn't know, get their cards, exchange information, and continue to have the conversation. And as you immerse in your community and feel that you are one of us or one of them, then you continue to move up into a role of leadership where you can have others and bring them into the family as well.
I would just say I'd seek first to understand, then be understood. There's a good rule with that. Listen a lot. And I think the other key thing is, if you're in a position of leadership, how are you creating space for others to lead? And how are you creating space for others? Because especially when we come from a dominant culture and we're at the table, we can end up dominating the table. And the question is, how are we sharing power? How are we creating space? How are we developing others as leaders? It's knowing when to step up, when it's appropriate and right for us to step up, and knowing when to step back and create room for others to lead. And so I think when you're in that situation, and myself as a white male who led a network who's very diverse, I didn't know how to step back, listen a lot, and really understand and take risks in aligning yourself with community, because a lot of times, a lot of communities feel that people don't listen, don't acknowledge, don't recognize, and I think when we start to advocate with communities, it makes a big difference.
So I'm going to imagine, and thank you so much for asking that question, but so I'm going to imagine that our friend who asked that question has learned how to be fragmented, like many of us. And we are so fragmented that at the end of the day, we become this entity that is separated from our other self, which is the one in which is easier to connect with community. I was invited a few years ago to a conference that had a name, something like Reclaiming Home. And it was a mental health conference for mental health providers that feel that they cannot have a community, that they only have an office and they see clients, but they themselves do not belong to a community, particularly if you belong to communities of color, immigrants, but not only them. So this idea that your brain and your work is here and your heart and your home is here is not helping us. And we have learned that we are deeply fragmented. So we need to defragment. And in order to do that, what I have done that has worked for me, actually, is to understand that I learned that and that I need to commit to unlearn. And the unlearning process has a different question than the learning process. The unlearning process has to answer the question, what have you unlearned lately? And we have to commit to unlearn something. And in order to unlearn, we need that safe space where we can tell them the vulnerabilities and they will see the good on us. It has to be a safe place to unlearn. And then we need to relearn. And I will say that to be part of a community, any door is a good door. Any door. The door of the homeless people in your city, the door of the kids that don't know how to read and write, the ones that don't know about math, any door. Community work is therapeutic. When you do community work, you gain more than what you give. Community will make you patient. Community will get you to connect. Community defragment. So actually, this is not going to happen unless you do it. You have to go. This is fitness for your heart. How do you get, muscles? You exercise. How you get good muscles in your heart? You exercise. This is not done with theory. This is done with a practice. And I think that if we own that, we can be part of that community that is ready for us.
I got a few questions about the health social services divide, and they go in somewhat different directions, so I'm going to tee them all up at the same time, and one of them is directed at me, so I'll take a first cut and then be really interested in how you all go with this. So one was a very specific question asking about the findings from the study. We recently published by Betsy Bradley and colleagues on health outcomes associated with social services. And the question is, were there any surprises other than red state, blue state differential? I'll come back to that in a moment. But the two other questions that are related, one said, some of the openings seem to suggest health versus social services. This seems like a false dichotomy. Can you offer some reflections? And then someone else said, what's a concrete step we can take at the state level to move power and money from health to social services? So I'm going to just start because the first of those was directed at me. I should say, I don't remember the paper talking about red state, blue state. We tend not to think of things that way at Health Affairs, but we did certainly, my recollection of the findings, and it's certainly the pieces available, is that larger shares, what the technique that she and her colleagues have used first at the national level of comparison, and then in this paper at the state level comparison, is basically to decompose state budgets and to put the health services separately from the social services. And what the method they used, forgive me for going into this for a moment, is to basically do a lagged correlation. So say if you spend more in 1 year in social services or as a share, do you see better health outcomes in the future? It's a fairly difficult method to feel total confidence about, and the authors are quite clear about that. But fundamentally, excuse me, I was hoping this wouldn't happen. Fundamentally, the findings of the paper are that increasing shares of spending, not levels, but shares of spending towards social services does have health beneficial outcomes in future years. So that's a pretty dramatic finding. And I'm not sure that the ratios do fit traditional red state, blue state, partly because those ratios are often long-standing traditions about government, and these are ratios, and so levels may be quite different in different places. I appreciate the challenge of whether the health and social services division is a real dichotomy, and for the 170 of you who weren't here last year and the others of you who don't remember, which is completely understandable, last year I actually talked about the birth of the department I used to run here, Healthcare Policy and Financing, which was the pulling of health out of the former Social Services Agency. I will just say, from my own perspective, in many respects it's a false dichotomy, except that a lot of healthcare services are what we think of as sort of rescue services. They don't create long-term sustained investments in people's future potential. They address immediate needs, and yet you could say the same about social services. My view is that I prefer not to have the dichotomy, and yet the story I told last year is that part of the reason Healthcare Policy and Financing was pulled out of social services is that our share of the budget was bigger than everything else combined, and so from a governance perspective it made sense to separate it out. So I think it is good for us not to overstate that dichotomy, and I appreciate the question. But let me turn to colleagues here and just see, I'm the one who sort of initiated the discussion about the two, and I wonder how you all reflect on that and the questions that were asked here.
So I'll give you an example. I showed a slide of where my mom was living, and I also showed you the house in which I grew up. And my mom lost that house with the whole bubble thing with the mortgages and eventually couldn't afford to pay it. And she had to navigate the system to be able to get a new place to stay. And they put her in this apartment. And when I went and the elevator didn't work, I mean, it's a lot of senior citizens there, the elevator closes and it doesn't have a sensor and recognizes that someone's in it. Now, the community within the building adapted, so they know, get out the elevator. I was new, and I'm trying to make the elevator open, and it doesn't open. And I'm sitting there, and I'm wondering, well, that's simple. Like, it's over 200 people in this building. There's someone who owns the building, and we can't get the elevator fixed? And then I looked around, and I realized that most people in this building are trying to survive. So there are other priorities. It's easier to just get off the elevator and know that it is going to close if you don't. And so as recent as about a month ago, my mom also receives the bridge card for Michigan, which are like food stamps. And she called me and she was in a frenzy because my 18-year-old brother just graduated from high school, which I'm so proud of him. And she says someone had gone and taken her card and bought like $500 worth of meat. And she had been saving some of the money to be able to buy food for my brother and his party. And I said, well, did you call down to whatever the number is? And I'm sure they have emergency services, because she had no money to even just eat. And she said, I called them and they said they don't replace it. I have to go and do a police report. So she gets transportation to do the police report, and then they said that they don't replace it, they just need the police report. So I'm thinking, oh, this is an issue of being able to navigate the system. So I'm gonna call, and I'm gonna get her some emergency services. So after about 20 minutes on the phone, waiting for someone to get on the phone, I'm basically told that we don't really have emergency services. We do not replace the funds when they're stolen, even though the person who owns the shop said, yes, this person came with some type of voucher and didn't even have a card. And if you really wanted help, you have to come to Lansing to get it. And I just thought that makes absolutely no sense. She lives in Detroit. This is an hour and a half away. How's she going to get to Lansing? And so I think at the end of the day, it's recognizing what the issues are, being able to hold our entities accountable, that if they just did the mission and the job alone that they're supposed to do, versus things that you were showing, $1 billion, was it $1 billion in fraud?
That was one.
That's just one team. So there are great examples of social services that do outstanding work. And then there are others that really need to be held accountable. But the sad part is that they know that the people that they are responsible and accountable to many times don't have the voice, don't have the skills to write, don't have the skills to get and stand outside of their office and hold them accountable. So that becomes part of our business, that when you recognize those, what can you do? What did I do? I wrote a letter. Did it make a difference? I don't think so. Got another letter back that just said, we are committed to blah, 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 blah. But at the end of the day, I ended up helping my mom. But she is one of many that are impacted by this. And if our social services really had policies that impact those who are most vulnerable and we held them accountable, that alone, I think we could see a lot of different changes.
So when I think in social service, and if I'm understanding both your comment and the question right, and maybe I'm not, but when I think in social service, I think in a very inefficient system. And I don't see them as leaders of system change, but understand that there are a lot of people in that system that want system change. What I see at the community level many times is the result of the wrong incentives for these systems. So we have incentives where people have to remove kids, for example, and place them in foster care because they are not funded to do prevention. So since my money comes to me once I remove the kid, I will remove the kid. So I don't know. I think this is a lot about finding the right incentives and shifting money towards prevention. I think, and that needs to happen in all the systems. This is also about, as a government person, I think I heard something in the question that says, what can we do from there? You know, when you have money and you have power and you do policies, you actually can become very creative to force a game by design. It's like being active by design. If I park the car here, far from the mall, I have to walk more. It's a design. So you design this game as power players for us to work with each other's system, or by continue working in isolation with the wrong incentives in transactions that many times are very humiliating. Very humiliating. If you want to see humiliation, go and check out everything that happens around the services that government offers. You know that there are no exceptions, but really, there are ways that we can change that. I tend to think in metaphors, like the metaphor of immunization. Immunization started by being a public health thing, and then it went into the schools, and schools asked for the immunization card. When you travel, they ask for your immunization card. Somehow, immunizations became a collective outcome. Domestic violence is no longer just a group of advocates fighting for that. It's in the police system, it's in the criminal justice system, it is in the medical system, you have to report it, it is in the school system. So there you go. There was something that was managed there. I wonder what can happen if we focus on the results that we want. We don't want kids in jail. We don't want kids to be born in our communities to end up in jail. So I wouldn't say just that. I will say, if I don't want this to happen, and I do this autopsy of what happened, why they end up there, and I go back, like the anatomy of this issue, then I will find a kid that probably didn't have support when they were born in that place, that then didn't have childcare or maybe lousy childcare, with a school that is pretty mediocre, and teachers that are very frustrated. And I'm just generalizing to make a point. And then, you know, that kid got in trouble, didn't get the help. And I called the police one day, and they said, you know, we can't do anything. Wait until he does something that is really bad. So we need to wait until things are wrong. And I think that a way of framing this when you have power, money, and policy is to say, I want to change that result. What will it take for the systems that were involved? Which are the systems that are responsible by negligence? Because this is not only about action. We are not just accountable by our actions. We are accountable by our inactions. And I think we need to frame that in a way that can make systems work together in specific things that can be accountable. But we need to give the system flexibility. So flexibility is the other thing that I ask for. If you give me flexibility to use the money, I might be more open to do prevention than if you don't give me the flexibility.
So I'm going to close with a question with quick answers because we really are out of time. Renesa, you introduced the subject of positive deviance, a term that I've always struggled a little bit with, but each of you told stories of, if you will, positive deviance, your personal story, the story of, their stories of leadership, their stories of communities, doing things that the community next door didn't do. So my question to close this morning is, what is the one thing that can help support those who have the potential to create positively deviant outcomes, whether they're at the personal level, the community level? What can we do to support and promote and elevate positive deviance from the norm?
So I'm going to copy, not original, something that the director of the Harlem Children's Zone said. He said, I want to help people improve and succeed in spite of the odds, but my commitment is to change the odds. Because one of us is great. Just change the odds.
Good. Paul?
I think that it's really engaging and listening would be my key, is really not coming into situations feeling that as professionals you have to have the answer, but thinking about what's the question I need to be asking.
And I would say I'll tap into that soul work again. If you are doing this and this is a job, this is a paycheck, please get off the bus and make way. And make way for people who this is their passion. It's not about that data. It's about the lives of the people that every single number in that data is represented by. Get off the bus, get in the right seat, and the how will be figured out when you are truly doing what you have been called to do.
Well, a perfect way to end a really exceptional morning. Please join me in thanking our panelists today. So it's time for lunch, and the great thing about lunch is not only do you get to eat it, but it is our chance to reset the clock. We will start promptly on time after lunch. I left my program at my desk, so I don't remember what time that is, but you will find it, and you'll be back on time for our afternoon keynote. Please enjoy your lunch.